Hi, it's Bill, the knee pain guru, and today is Thursday, April 25th. Welcome. Today we're going to talk about finding solutions for meniscus tears. We'll be getting into that in just a few minutes. If you have questions regarding meniscus tears, knee pain, doctors, physical therapists, exercise, whatever it is you're dealing with your knees, put them in over in the comment section on the side, and I'll get to those in just a minute. Please make sure to give the video a thumbs up, like, and subscribe to my channel, as well as turn on notifications for future videos that I will be doing on, in, and around the topics of knee pain. So we're looking at finding solutions for meniscus tears. And it's important to understand, first and foremost, that not all meniscus tears are created equal. Meniscus tear, there's a lot of things to understand about your meniscus tear first, and this you can get from talking with your doctor to understand exactly what you're dealing with, because not all meniscus tears are created equal. There's several things to look at. There's the length of the tear. Meniscus tears could be 1 millimeter as well as several centimeters long. You have the location of the tear. You can have it on the inside of your knee, or the medial side of your knee, or the lateral side of your knee, the outside of your knee. You could also have it towards the front of your knee as well as the back of your knee. You have the direction of the tear, meaning the tear can be going vertical. You could have a vertical tear in the meniscus. You can have a horizontal tear in the meniscus. You could also have a diagonal tear in the meniscus. This is all your homework, essentially, to find out exactly what you're dealing with before you figure out a strategy of how to get yourself out of pain. It's important to have this information. When I work with my clients, I tell them we can't straighten up the living room until we turn on the lights. And a lot of times, because not all meniscus tears are created equal, the knee pain isn't going to be the same depending on the length of the tear, the location, and the direction of the tear. All of that needs to be understood by you as well as your doctor in order to develop a strategy. And you'll understand that in just a moment, because there is a study that was done at the, let's see. This was an arthroscopic partial meniscectomy versus placebo surgery for a degenerative meniscus tear with a 2-year follow-up of the randomized controlled trial. So essentially, they took a specific type of meniscus tear on the inside of the knee, and they took a group of people, split them into two, and they did the arthroscopic surgery, which is the keyhole surgery, in one group, removing the tear of the meniscus, essentially trimming the meniscus. And then he did a whole nother group that they just put the holes in the knee. And after 2 years, they found that after a 2-year follow-up of patients without knee osteoarthritis, but with symptoms of degenerative medial meniscus tear, the outcome of the surgery was no better than those after the placebo surgery. No evidence could be found to support the prevailing ideas that patients with the presence of mechanical symptoms or certain meniscus tear characteristics, or those who have failed initial conservative treatment, are more likely to benefit from the surgery. So there you go. However, that was a specific location on the inside of the knee meniscus tear. So it's a very small type of group that they targeted in terms of doing this study. But it kind of begs the question, is surgery really going to help what's going on with your knee or not? This is a conversation to have with your doctor. Ask them straight up. And this is a really good question to ask them. If your mother had the same meniscus tear in her knee, would you recommend her to have the surgery? Is there other solutions you can go with without going with surgery? There, depending on, this is all kind of going back based on the length of the tear, the direction of the tear, and the location of the tear. There's the possibility that the tear can heal on its own, or if going just to physical therapy can resolve. Also the possibility with the meniscus tear that, depending on the length, the direction, and the location, that the doctor can actually stitch up the tear. You think of a meniscus tear like a hangnail, that depending on how you move, you're going to catch it. And what the doctors are able to do is actually sew the meniscus back together and give it the opportunity to heal. So these are all factors that take into consideration for finding your own solution in addressing meniscus tears. So I want to pause there for a moment. There's a few people watching. If you have questions about knee pain, meniscus tears, whatever that is, please put those in over on the side, and we'll address those in just a moment. But I just want to give you an idea as I was delving into this, because I had 2 pieces of meniscus removed from my left knee. I dislocated my left knee 4 times over a period of 5 months and had torn the ligament in my left knee. So let me see here. Okay, I think we got the chat squared away now. Okay, so 2 pieces of meniscus that were torn in my left knee. I had the ligament in my left knee, my ACL torn. They did a patella replacement in my left knee. What happened, or what I felt since the surgery, was there's a slight, depending on how I walk a certain way, I'll feel like a little bit of a pop that'll take place where the meniscus was torn. Now, when the meniscus, how I tore my meniscus, I was actually throwing a softball. The last time was throwing a softball to first base from the shortstop position. So my knee was rotating and it popped out. It was one of those situations where my age, I was 28 at the time, I was very active in the sport of judo, and I wanted to get back out on the mat and throw people again. So my main focus was getting the meniscus repaired, the ligament repaired, so I can get back out on the mat, so I can compete again. That was my goal. I had a very clear goal in mind, and I had 2 flaps of meniscus in my knee that were torn quite well. So it was one of those situations where maybe if I was patient, maybe if I backed off of my physical activity, it would have been better for me to heal it naturally, or see if I could heal it naturally. But that wasn't where I was at that time. So the length, location, and direction just wasn't feasible for that to heal on its own for me at that point in time in my life. Having it removed was infinitely easier, so I can get back to my busy life. So that is this topic, as I've been studying it more and more, needs to be niched down even more. Even with the study that they did, it was only on the medial or inside part of the knee with that placebo thing. So it's really important is to have specific instances of looking at, well, what are you dealing with? The length of the meniscus tear, location, and direction. So that's, and from there, you can determine how you would want to proceed. Where are you at in your life? Are you 60, 70 years old and you're just trying to be comfortable into your later years in your life, or in your 20s, and you have a good portion of your active life ahead of you, what do you want to do? You have to kind of take a lot of those factors into consideration, as well as what you're dealing with the meniscus tear, to find a solution. So that's what we have for today. It's important, I think, at this point, in order to understand, you need to gather more information so you know exactly what you're dealing with, to then develop a strategy. And if in fact you would like to develop a strategy, feel free to reach out. You can head over to my website, thekneepainguru.com. There's a lot of resources over there, as well as we could set up a time where we can talk about what's going on with your knee, figure it out, whether it be strictly a medical approach, Western medicine approach, a holistic approach, or an integrated approach. Many times the integrated approach is much better because you're getting both of the Western medical model, especially if something's broken or torn in the knee, meniscus being torn, or you're looking for a holistic solution of how to create comfort in the joint, how to increase the range of motion, how to heal the fastest after surgery, making sure you're water as you move down the road. So one more chance, got about 30 seconds left to enter some questions over on the right-hand side. And if you don't, that's okay too. I have a group coaching call here in a little bit that I'm going to bounce off of and onto to help them with their knees. So thank you so much for being here. Remember to give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, on YouTube, as well as turn on notifications for future videos. So this is Bill Paravano, The Knee Pain Guru, thanking you so much for being here. Have a wonderful day, and I will see you on the next video.